Kai has been a patient with children since, I guess, before he was born. Kai was not growing, I mean, he's very small even now, but he was not growing well, which is not uncommon for kids with heart conditions and the multiple issues that Kai has. We were referred for a feeding tube and saw Dr. Jassinger when he was just shy of a year old. He got his feeding tube. The kind that Kai has is called a G-tube. And then it's called a button, I guess, because of what it looks like on the outside, looks like a button. Once he had his surgery, pretty quickly after we got into a room, Karen, the nurse, came in and she said, I will be teaching you what to do, how to feed your child, and when the button comes out, she said, because the button will come out, what to do. She did a very good job of seeing how I learned and tailoring the education to that. I left feeling confident, one, that I knew what to do, how to feed him, but also that I would know what to do when the button came out. 2 weeks after we came home, we were doing really good. I was getting ready to feed him about 11 o'clock at night. When you are feeding a child with a G-tube, there's a tube that you attach temporarily that's called an extension. My husband was holding him and the extension got stuck on something. I hear my husband just kind of scream my name. He said it came out and he was very emotional. This is very scary for him. And I said, okay, let me go get the kit. I know what to do. Karen told me. So I got the kit and I'm hearing Karen's voice in my head of, it's gonna come out. Just get the tube and put it in, tape it down, and call the ER. The surgeon was telling me, she said, you were so confident on the phone and you were so calm. You just did a great job. And I said, it was all because I had Karen. She made what I thought was gonna be really complicated and scary very simple. She was confident that I could do it, and that was very helpful because I was scared. She empowered me to do what I need to do for my kid. I would encourage parents, if their child's doctor is talking about getting a feeding tube, to ask lots of questions and practice while you're in the hospital, while you're around nurses. But the great thing about the surgery clinic is they have email that you can email, you can message them, you can call them. I found them to be very available when I needed them. So for that, I'm very grateful.